Hello, this is Dr. Marianne Jackson, Chief of the Section of Infectious Diseases at Children's Mercy Hospitals and Clinics in Kansas City, Missouri. I'm here today to talk to you about 2009 H1N1 influenza. Since the start of this pandemic, I've been inundated by calls from parents and pediatricians who want to know more about this virus. What makes it different? Why is it important to know about? And what are we doing about it? Well, first off, let's talk about what influenza is. This is a viral illness, and seasonal influenza is something that you've heard about. It circulates every year in the winter, starting usually around the first week of January and circulating through to about 12 weeks. The disease it causes is usually quite similar in all cases. It is the abrupt onset, meaning sudden onset, of high fever, usually over 102, with severe muscle pain in association with cough and sore throat. This viral illness usually runs a course of between 3 and 4 days. In most cases, patients are getting better by that time with an entire course of between 7 and 10 days. What makes 2009 H1N1 different is that this virus, which normally has just a slight drift each year in what it looks like in terms of the virus that's circulating, has changed entirely to a virus that's never been seen before. So this means that instead of 20% of the population at any one season becoming infected with influenza, we can have an entire population infected with 2009 H1N1. Now, the good news is that so far this looks like a relatively mild version of influenza, meaning once again, fever, muscle pain, sore throat, and cough will be the primary symptoms. It will get better within 3 to 4 days, and what we'd suggest that you do to take care of it is to take ibuprofen or acetaminophen to control your fever, and make sure you stay well hydrated. So fluids and even chicken soup is a good idea for treating the flu. For those individuals who do not get better by day 3 to 4, or who are getting better and start getting worse, this signals a complication. And the complications of influenza are very typical and very similar no matter what flu strain is circulating. So in children, we will see ear infections and sinus infections, and occasionally pneumonia. The pneumonia can be due to the flu virus itself, or it can be a severe complication due to a bacterial germ such as streptococcus or staphylococcus, including MRSA or MRSA infection. These bacterial infections can be very serious and they can be rapidly progressive. So if you are not getting better by day 4, if you suddenly start getting worse after day 3 to 4, see your doctor because you may need further evaluation. The other question that I get asked commonly is, shouldn't I get Tamiflu or oseltamivir, the antiviral drug that can fight influenza? This drug is recommended for certain individuals. We know that influenza, and this is all types including 2009 H1N1, can be more severe in individuals who have certain high-risk medical conditions. Those high-risk medical conditions include things like pregnancy, heart disease, lung disease, or an immune-compromising condition, or a neurologic disease or neuromuscular disease. Children under 6 months have a higher rate of complications, and children with any of those high-risk medical conditions have a higher rate of complications. If you developed influenza, including 2009 H1N1 influenza, and you have one of those medical conditions, you definitely need to talk with your doctor about treatment. For all the rest of the healthy individuals, the recommendations right now are do not seek medical care if you're only mildly ill, but do take your precautions at home, including fever control and fluids, and make sure that if there are high-risk contacts in your household, meaning those with other medical conditions that fell into the categories that I mentioned, that they are actually getting the antiviral treatment. So treatment is reserved right now for the high-risk individual, and it is discouraged for the otherwise healthy individual. We worry that resistance could grow, as it's already been noted in at least one city in the United States. Lastly, what should you do if you get H1N1 and are treating yourself at home? Well, first off, stay at home. Do not go to the mall. Do not go to public gatherings. You need to stay in your home and quarantine yourself for at least 24 hours after your fever is gone. Remember that there are other viruses circulating, so if you get fever, cough, and cold, it may not be 2009 H1N1, and it may be another virus. But the rules are the same for all of these viruses. Things you can do at home to protect yourself and the rest of your family: make sure you do good hand washing, make sure you use cough etiquette, which means covering your cough and throwing away your tissues, and make sure that you're staying home until you're well. For more information, check our website at childrensmercy.org, and we can connect you with our top 10 things you need to know about 2009 H1N1 or some of our other vaccine sites. She's shaking her head yes. Did I hit all the information? Yeah, okay.